Greetings. I am Dr. Junhyouk Shin. First, I would like to convey my gratitude to DIOimplant for giving me this opportunity to lecture online. I would like to start the lecture with the desire that the contents I will be presenting on aesthetic incisor prosthesis would be helpful to you. I am a dental surgeon with my own dental clinic in Busan with immense love for aesthetic prostheses. I have been managing my dental clinic for more than 20 years. In addition, I have been lecturing about digital dentistry for about 10 years now. As a dental surgeon with experience in implant placement and having managed my clinic for 20 years, I will examine the changes in implant along with digitalization. First, there have been a lot of talks about fixtures in the past. There were extensive researches on the surface processing method, fixture type, and machine surface, etc., which were the key issues. Then we moved on to the next stage, and the issue at that time was the abutments. As such, customized abutment, or full zirconia in molars, actually became the key issue. This was possible due to the substantial advancement in the CAD/CAM software in the dental industry. Zirconia itself is the type for manufacturing prostheses through milling. Therefore, the foundation for the surrounding conditions of milling has been established extensively. This has imparted substantial influence on individual dental surgeons managing their own dental clinics. If you look around these days, there are a lot of talks about oral scanners. CT cost has dropped markedly in comparison to the past. I am not sure about the situations in other countries, but this is the case in Korea. As far as I know, it is now a global trend. CT price has dropped substantially and is spreading among individual local dental clinics, and the 3D printer has been developed extensively as well. DIO has been applying 3D printers called Probo to many dental clinics, which are reasonably priced and compactly sized, that are very convenient to use with outstanding performances. So DIOnavi guide is the keyword nowadays. In addition, technologies on the implant technique of further expanding and utilizing this guide in various aspects of dentistry have become the talk of the town. This is the current trend. From the era of interest in fixtures and abutments in the past, we are now moving towards the era of interest and focus on the techniques of placing implants. If the trends in our surroundings are conjectured and pondered over whom the dental industry will advance in the future and which trend dental clinics should follow to stay a step ahead of others, it can be seen that although we only had huge software for the advances in our surroundings in the past, we are now seeing marked advancements in applications that we need nowadays. Digital dental applications that have become more detailed and can be used for numerous purposes are being created. Moreover, these applications can be operated automatically, with a simple click, without the need for particular specialized efforts. We have reached the situation in which these applications can point to the directions to a certain extent in various aspects, such as the position of the guide. There have also been extensive advancements in AI, artificial intelligence functions, and, more importantly, networking. Networking technology has advanced markedly through the advancement of digitalization, even for dentistry. These advancements include various storage services, such as NAS and cloud, along with the increased speed in this era of 5G. As such, I would like to lecture on the changes that are likely to occur in our dental industry in the future, with a great deal of curiosity. I will now talk about aesthetic incisor prosthesis. I will deal with my thoughts on the aforementioned curiosities about aesthetic prosthesis. At our dental clinic, other doctors who are working with me are providing treatments in their respective individualized and specialized areas. As the representative director of our clinic, I am mostly in charge of incisor implants, incisor treatment, complicated implant cases in general, and complicated prostheses, etc. In doing this, rather than progressing only in the direction of digitalization unconditionally, I use the strategy of mixing and matching. I am considering which is more reasonable and which gives better results for the patients, rather than making a distinction between digital and analog. In fact, I ponder over the workflow in operating my clinic. I will illustrate a case first. When we have a patient who visits our clinic due to an accident, we used to extract the tooth, place implant, and made temporary tooth manually. But my workflow has changed nowadays. If a patient visits us under these conditions, I make a guide first in order to provide a temporary tooth immediately. In doing so, I am able to go through the process of achieving excellent case of implant extremely simply. The important fact is that many dental surgeons in Korea are having a lot of concerns these days. Substantial investments were made for the purpose of digitalization of dental procedures. Accordingly, dental clinicians are pondering over the issue of how to differentiate between the clinics that made a substantial investment into digitalization and those that have not. It is the same for me. Although advertisement, marketing, and promotions were sufficient in promoting the clinic before, now these aspects are not sufficient to show distinctions among clinics because the digital is too spread out in the market base. My thoughts on the actual advantages of digitalization are as follows. It is more convenient in reporting the details of the treatment process I will be rendering to the patient visually. I am utilizing digitalization more extensively for explanations or procedures after the treatment, during consultation prior to treatment, in comparison to the past. In my opinion, treatment reporting is much more important than the treatment procedure for incisor treatment. In addition, if digital technologies are used, they should be promoted to the patients. Such promotion is not just a simple boasting of the equipment used. Rather, I am striving to promote highly digitalized dentistry through the use of such equipment as tools that make such reporting. I believe it is a means of approaching patients more directly. It is now possible for anyone to design such a guide, as it has become so much easier. In fact, I have been designing guides personally up until several months ago. However, I was able to secure an excellent dental technician who is now designing the guides. So the design is made by the technician, and I only have to check and confirm the design made. After the guide is designed, I directly visualize the design through three-dimensional simulation, rather than verbally describing them to the patients. Moreover, it is possible to directly communicate not only with the patients, but also the dental technician through CAD. These, in fact, are the strengths of communication and networking. There is an application called the Guide. Crown is designed naturally through AI like that. Then there also is networking, through which files of all the personnel in the dental clinic, including hygienist, dental technician, surgeon, patient, and information desk, etc., can be shared. While networking the files of each other, many aspects of operation in the dental clinic become digitalized. In the case of the guide, there is a server within the clinic called NAS. If the clinic is equipped with this server, now an environment has been established in which the files can be stored within the clinic and download for use whenever necessary. Therefore, I believe this networking environment is extremely important. Through the utilization of this network, it is possible to describe and illustrate to patients which treatments have been rendered and will be rendered in the future. In fact, even if the patient is a foreigner, it is possible to communicate quite proficiently, even if I am not fluent in English, if this network is utilized. I would like to emphasize that we are currently in an era in which these things are possible. If a file on a digitally produced prosthesis is stored in NAS and network, it is possible to describe the disadvantages of having a hole in the screw type of implant prosthesis to the patient more easily. This includes the disadvantages of a cementation-type prosthesis or screw-type prosthesis for which food can be stuck in the prosthesis. Describing such disadvantages of the prosthesis to the patients before the treatment, rather than after prosthesis treatment is completed, will help them understand better and easier for clinicians to explain. Nowadays, I don't use the software. While I am treating other patients, our hygienist and consultant are using this program proficiently to provide explanations to the patients, thereby achieving a highly digitalized treatment reporting procedure. In fact, these things are progressing even further from the viewpoints of patients. In this respect, my workflow can be divided largely into 4 stages when treating the incisors. And today, I will be talking about the first of these stages. I would like to describe which digitalized workflow I employ for treatment at the stage before the treatment. There are various stages. Let's have a look at the methods we use for incisor treatment one by one. First, the term incisor treatment can induce the thought of teeth whitening by patients. However, whitening is a very abstract term. The significance of making something white can be very diversified. As such, the whiteness that the patient thinks differs from that of mine. Since there is such a wide range of white colors, there is a limit to whitening. There definitely is a limit in bleaching color with chemicals. Although the patient visited our clinic with a desire for a white color, like the ceramic tiles, we recommend a more lucid, transparent, and brighter white color. Accordingly, what each other wants can be different. It is the same for the whitening of gum. Although the application of the method for removal of melanin pigment, like that, is a well-performed case in our thoughts, I believe the level of satisfaction of the patient differs, depending on the extent of communication from the viewpoint of the patient. In the case of resin treatment, although we manage to improve aesthetic appearance through resin treatment like that, it may not be the shape that the patient was thinking about. Although the dental surgeon may think that the resin treatment is quite successful, the patient may be dissatisfied with the asymmetry and size. It would therefore be highly advisable to communicate extensively before the treatment. It is the same for the laminate treatment. The laminate was set with minimal invasion, without deleting tooth, and a single tooth was fitted in. Although tooth number 11 was treated naturally, it is slightly larger asymmetrically compared to the next tooth. I believe it is important that such a result was informed to the patient in advance. Just looking at the tooth, laminating the tooth itself was performed very successfully. Both the arrangement and color are excellent. However, when the patient's face is viewed, there is a slight canting. It is slightly twisted, like this. It is important to inform such things to the patient before the treatment. For example, if the patient points out that the tooth is slightly twisted due to misalignment with the midline of the face after the treatment, it would be very disconcerting. However, if the possibility of such a twist is informed before the treatment, the patient may be able to better understand and accommodate the result. The method that I actually use in such a process is to take a photo of the patient's face when they first visit our clinic. By directly drawing and writing on the facial photo with the patient, I personally explain various shortcomings that could occur. Doing this, that is, telling the patients of possible shortcomings, is very important at the initial examination for aesthetic treatment. Even at the time of crown treatment, I talk about problems and aspects that may not be improved in advance in such a manner. I think the discoloration on the gum side can be lessened, but cannot be resolved completely. Or, since the crown is protruded out, it needs to be pushed in when placing crown again. Or, I think we can put 4 teeth here. So, if I talk about these things before the treatment, we can achieve better results. When discussing these issues, I believe that the process of directly drawing and writing on the facial photo of the patient and talking about them is the digital drawing process. This is the method that I use mostly. In addition, it is necessary to take facial photos and directly talk with the patient during the interim stages following the stages of the temporary tooth before manufacturing the final prosthesis. This will ensure the establishment of a beneficial environment under which the dental technician can make an even better prosthesis without having to make it several times. There is a statement in an old paper. Although diagnostic wax-up is necessary, it is rarely used by dental surgeons because of the extensive efforts and costs. This is actually true. Although it is essential to perform diagnostic wax-up at the time of incisor treatment, it is rarely carried out. I explained what would be desirable in digital format. In fact, if problems in the face can be resolved, and things that the patient requests and things I can do can be done before wax-up, this could be a process that can achieve much better effects than wax-up, without having to put in substantial efforts. If there are many things that need to be considered for incisor treatment, these images and photos can be greatly helpful.
그리고 실제로 이제 제가 그렇게 했을
If I
때
were to do it in
제
my own
스타일을 보면
style,
그러면
how
어떻게
could it be
하느냐?
done?
구강 스캐너가
If the clinic
처음에
has
이제
an oral
민초과에
scanner to start
있으면
with, how
그걸
can it be
어떻게 하려고
utilized?
하느냐? 초진
I
시에
scan the oral
환자분을
cavity of the patient
저렇게
with
이제
the
일반적
scanner at the
스캐너로
time of initial
진행합니다.
examination.
앞니 치료 환자의
For incisor
경우에는
treatment
자,
patients,
저렇게 해서 환자분의
I
치아
can
상태를
personally explain the
직접적으로
conditions of the
우리가
patient's teeth
엑스레이와
in this
함께
manner,
저런
along
식으로
with the
이제
use of
말씀을
X-ray
드릴 수가
images.
있고요. 두 번째는 이제 저렇게 스튜디오에서 얼굴
Second,
사진을 찍어서
I take a facial
직접
photo
아까
with
말씀드린
Studio
대로
and
얼굴
personally talk about
상태에서
what the patient
환자분이
wants,
원하는 거
how improvements
어떻게
can be
개선할 수
made,
있는지
and what the
문제가
problems
뭔지
are for the
그런
existing
것들을
conditions.
이제 직접적으로 환자분께 얘기하고요. 그리고 이제 저런
Moreover,
것들을
instead of the dental
굳이
surgeon
치과
personally
의사가
doing
다
all
해야
of these,
되는 저희
other
스태프들이
staff
같이
can
협업을
collaborate
해서
and make
저렇게
preparations
이제
in
미리
advance.
준비를 해주시면은
In this way,
그 원장님
dental
저희
surgeons
입장에서는
can conduct
굉장히
treatments much more
편하게
conveniently
이제
and
일할 수
efficiently.
있습니다. 저런 이제 치아
I
사진도
take photos
찍고
of teeth like this.
자, 그리고 이제 아까 스캔한 거랑 얼굴 사진이랑
We have a
이걸
program in the
두 개를
dental lab
합성을
that
해서
merges the scanned
저렇게
image of the
이제
oral cavity and facial photo.
동실에서 우리가 저렇게 합성을 하는 프로그램이 있습니다. 그 프로그램을
It is more
통해서 스마일
advantageous to
디자인을
perform
하는데
smile
좀더
design through this program.
좋고요. 그리고 나중에 또 설명을 드리겠지만
I will
저렇게
explain later
디자인한
that this
거를
design made can be outputted
캐드상에서
in a file
그거를
format
이제
with
파일로
CAD.
뽑을 수가 있습니다. 그래서 우리가 3D
The image after the
프린터로
initial examination
초진과
and
그리고
after the
치료하고
surgery
난 다음의
is printed out with a
모습을
3D printer and in a
파일과
file.
3D 프린터로 모형을 뽑아서
After that, the 3D printed model, which is expected to be the final prosthesis and is a digitally diagnosed wax-up, can be used to go through a mock-up process in the oral cavity after using putty to take an impression. This is the appearance of works performed in this format. In the past, taking an image with the wax-up was a difficult process. However, this process, in digital format, is very convenient. It costs substantially less, and even the staff can perform it easily. Therefore, in our clinic, we take the oral scan first when the patient comes for the initial examination. A facial photo is taken along with the photo of teeth to perform a mock-up work with the 3D printer in the dental lab. Then, it is filmed in the mouth again, and I would consult with the patient in a mock-up state. On busy days, what would be done on the first day is delayed, and the mock-up is performed on the second day. At any rate, we perform these first, before treatment begins. The mock-up process, as I explained earlier, is the process of enabling the patient to experience how the teeth will be widened and how their shape will change by communicating with them. If the patient is satisfied with the presented appearance, resin or laminate treatment will be carried out as illustrated. However, if the patient feels that the teeth are too big or too small after seeing the mock-up process, it will stop there. I will then talk with the patient about using other methods, such as orthodontics. Since the laminate treatment cannot be temporarily set like the temporary tooth, it is very difficult to correct the laminate after it is attached if the patient complains about them. Therefore, there is a need to sufficiently talk about the treatment before such a process. When proceeding with the procedure by making a mock-up, a material called wax temporary is used extensively. This material hardens in about 2 minutes. Invest only 2 minutes, and a lot of things can be solved through this process. There was a patient who visited our clinic to prepare to enter a beauty contest. This is a case from last year. The patient visited our clinic because the incisor was pot-shaped like that, and there was a space between the two incisors. Deciding on whether to work on only 2 teeth or on several teeth to change the appearance overall can be decided easily because it is made with CAD. Then, we make a mock-up of the design with a 3D printer. You can present the result to the patient in 3D also. The shape can be corrected by attaching only the front portion like that. This illustrates that it is possible to change the shape like that in advance through the use of a mock-up. That process is not difficult at all. It can be completed in 2 minutes. The patient chose to work on only 2 teeth rather than all the teeth, and the shapes of only 2 incisors were changed. Although it was only a slight change, it was an enormous change in the facial appearance from the perspective of the patient. Since such laminate is extremely thin and transparent, it is not possible to achieve the desired effect by grinding it with a machine. It is a porcelain laminate using platinum. It is very thin. It can only be made in an analog method. As I explained earlier, my aesthetic prosthesis style is mix and match. Although the final prosthesis was set in an analog method, everything else was in a digital process. That is, all the processes, including the wax-up, consultation with the patient, and the mock-up, were digitalized. In fact, since the mock-up process was an extremely difficult process through the analog format in the past, it was omitted frequently. However, since it is done through the digitalized process, it can be conducted easily once the workflow is determined. It can be established easily through collaboration within the clinic. Once the workflow is established, the treatment is reported. This can illustrate the changes that will be made to the patient in 3D. Moreover, we give the 3D printer model to the patient in some cases. The patient will take it home and use it as the data for discussion with their friends and family members before the treatment. This is referred to as treatment reporting. If you look at the appearance before and after the treatment, it is possible to confirm that there is substantial improvement in the face. Therefore, due to the presence of a 3D printer model before the treatment, the patient can more easily discern how much change has been made. That is, it is greatly helpful in providing explanations from the viewpoints of the patient at the time of incisor treatment. We first take a facial photo, perform mock-up work on the patient, and explain the results to the patient on the CAD screen. All these processes are digitalized. It is possible to easily discern how much change is made through mock-up work through the facial photo. That is, we can check by looking at the entire face and expressions, rather than looking only at the teeth. Software is really easy to use. She is a student who came to our clinic for a dental practicum. She was an intern from a hygiene department. Even though it was only her second day, she was able to easily use the software. Since the software is highly intuitive and with highly advanced AI, it can be used very conveniently. Like that, everything is changing and advancing. Since they are in a file format, it is easy to store them. In addition, since we save the data in our NAS networking, it can be downloaded to a computer screen for comparison. Such a 3D model is printed out and presented to the patient after the treatment to confirm how much change has been made. All these processes are the elements of treatment reporting. This became possible due to significant advancements in the CAD software, application, 3D printer, and network. Then, pondering over the most effective workflow for incisor treatment in this manner will ensure competitiveness in the future.
라는 제 말씀은
Digital technologies are continually changing and advancing.
변하고 발전하고 있잖아요.
If we establish the workflow for such digitalized process in advance, our staff would be able to follow the elements of the established workflow without getting confused. If there are further advancements in the elements of the workflow, they can adapt to them gradually and achieve self-growth step by step for the dental clinic to succeed continually as a whole without falling behind others. Since there are two extensive advancements, it would be difficult for the staff working with you to adapt to the rapid pace of changes if you establish an environment that reflects all the changes at once. If that is the case, in the clinician's perspective, it will become an environment in which everyone has to start from the beginning whenever a new staff joins the clinic. Therefore, the workflow must be set when the digital system has been implemented for each dental clinic. Once the workflow is set, the level of utilization of digital devices will be stable, and it would be possible to maximize their effectiveness. In fact, in the cases of all-on-4 and full mouth, a full implant, such as DIO full arch, is performed quite often nowadays. Even for such cases, conditions in the oral cavity are checked and confirmed through the 3D printer. It is possible to experience and check how the food gets stuck, what the gum border will appear, how the lip support of gum will be, how much philtrum will be protruded, and how sunken the mouth would appear in advance by taking a facial photo. A patient will view them, and discussions will be made with the surgeon before making the large prosthesis. In addition, the 3D printer has other major advantages over the analog method used in the past. Since it is made in layers, it is possible to produce 20 to 30 units on a plate. Therefore, the time that goes in to make 1 unit or 20 units are the same. In the case of the full mouth, I frequently make them twice. I make them for the patient to put them on before they leave the clinic if the patient needs them. Then it is put into the patient's mouth to take a bite impression, and it is taken out again and mounted for a dental technician to make a reference for the prosthesis. For this reason, I make 2 of them. In addition, since a temporary tooth cracks often, it has the advantage of being able to make a temporary tooth quickly and easily. Given my past experiences, PMMA made with a 3D printer has a tendency to break easily. So, I frequently have to make it several times. I use the temporary tooth to check in the clinic, rather than for the patient to return home wearing it. When it is placed, I believe it was a process of checking the bite and vertical dimension, horizontal position, lip support, and various shapes of the teeth that we thought of. That is, the process of communicating the shape of teeth that the patient is considering with the shape of teeth we are able to produce. In the past, there were numerous cases where, after the process of making a wax rim, Gothic arch, and bite impression, it went straight to making the final prosthesis. Nowadays, it is possible to talk with the patient before making the final prosthesis through a digitalized mock-up work instead of diagnostic wax-up for aesthetic prosthesis, which is used extensively in the interim inspection. That is why this is extremely good. Workflow for these processes at our clinic changed again through digitalization. Mock-up work has entered the workflow for incisor treatment. In addition, for a large case prosthesis patient, full mouth cases, and implant cases, the interim inspection process is generated through temporary tooth production with a 3D printer which has become very helpful in dentistry. This is the power of workflow, and it was not established overnight. When digitalization is introduced, even dental surgeons need to undergo some training. Dental technicians must train about the workflow also. Most importantly, it is essential to train the hygienic staff. Therefore, it is our belief that such workflow will become our competitiveness. Rather than having a dental surgeon or the dental lab decide whether to use a tooth-type prosthesis or to use a hybrid-type full-mouth implant prosthesis that includes gum on their own, confirmation is made in advance through the 3D printing I mentioned earlier. Process of confirming whether to use tooth-type or hybrid-type that includes gum, since they have their respective advantages and disadvantages, is possible due to the advancement of the 3D printer. This has become an important workflow. Another advantage of the workflow is that since majority of full-mouth implant patients come to dental clinic with very poor conditions to the extent of the tooth being almost completely destroyed, shaking extensively, and just about to fall out, it is possible to make a temporary denture in advance if the patient wants to wear a temporary denture on the date of tooth extraction, or the day of implant surgery, or the next day. It is possible to make the daily life of the patient more comfortable and convenient by making a temporary denture with a 3D printer. This has also become a part of the digital workflow we established for the treatment of full-mouth implant patients. In fact, we are checking whether to use hybrid type or tooth type through the use of temporary tooth when treating such patients. Accordingly, if you look at the actual photos, the first photo doesn't have anything. Temporary tooth is placed. The next is where a hybrid type is placed. A hybrid type is placed here, but a slight correction was made because the gum seems to press on the philtrum too much, and this is a week after. We can check these things. It is possible to initially make it in tooth type and then change it to hybrid type because the workflow is possible. It seems that the hybrid type would be more advantageous for this patient. I mentioned in the past that there was a process of teeth making a profile on the gum in an S-line. While making a natural-looking prosthesis shape on the gum was the focus put on by the dental clinic in the past, S-line, or profile on gum, philtrum, and lip support by using cephalometric photos are the important aspects when performing large prosthetics nowadays. That is the reason why we are paying much attention to these aspects. It would be an enormous loss if we have to remake a large, complex, and very good prosthesis we already made because it does not harmonize with the patient's face. Making prostheses by checking the profile through the interim inspection process with a 3D printer to prevent such loss can establish an environment in which all the interested parties, including the patient, dental technician, and dental clinic, can be satisfied. Therefore, digitalized treatment, as in the case of the processes of incisor implant explained earlier for the full implant case, can be a very important process. In addition, by taking the bite of the same gum type and transferring it straight from the dental lab can be an advantageous environment when making the final prosthesis. In fact, for incisor treatment, I mentioned that explanations are provided to the patients by taking a facial photo and drawing various problems at the time of initial examination. It is the same for the full implant case. It is also possible to check the temporary tooth in the middle of the procedure by writing down memos in advance like this. This can be a process that produces good results for the patient when we move on to the final prosthesis.
그런 과정이 될 수 있습니다. 사실 이렇게 이제
In
치아
fact,
임플란트를
it is
굉장히
also important to place the
좋은
tooth,
위치에 심고
implant, and
임플란트
prostheses
골절이 굉장히
in a
잘
desirable,
심고
beautiful
예쁘게 된
position.
것도 중요하지만 요 케이스처럼 치아의 모양은
However,
이
in this
항상
difficult case,
약간 진지발
if you look at the
레벨도
tooth
맞지 않고
only,
치아의
I
어떤
can't say it is a good
크기라든지 이런
prosthesis,
것들도
seeing that the
굉장히
gingiva level doesn't
그
match
치아만 봤을
and the size
때는
of the
굉장히
tooth is not
좋은
appropriate.
보철이라고 얘기하기는 조금 힘들지만 그렇지만 굉장히
Nonetheless,
낭비시잖아요.
it is a very
근데
significant
환자분
change
얼굴에서
when
봤을
viewed in the
때는
patient's
굉장히
face.
큰
On the
변화고
contrary,
오히려 앞에
it can
그런
be a case that offers
치아가
greater
자연스러운
satisfaction and
케이스보다는
happiness to the patient
환자분에게는 이게 더
rather than the case
행복감을
before
주는
where the teeth look natural.
됩니다. 그래서 저는 이
Accordingly,
케이스를 훨씬 더
I like this
좋아하고요.
case much
이
more.
케이스를 굉장히
This is
좋아하는
one of the
케이스
cases
중에
that I
하나입니다.
like very
근데
much.
실제 그 중간 단계에서도 그런 3D
In fact,
프린터로
during the middle stages, I can add numbers or comments such as, it looks too long, or it'll be better to set the midline like this, and I can make a much better prosthesis than giving a photo to the lab technician for reference.
보다 좋은 보초를 만들 수 있죠. 그래서 전학 임플란트를 할
So,
때는
when I do a
저는
full
개인적으로
mouth
생각합니다.
implant, I personally observe the facial changes of the patient more, rather than rendering treatment by only looking at the tooth.
좀더 관찰을 하고 그렇게 해서 환자분이 좀 더
I believe it is a truly successful treatment when the shape that can make the patient look younger and more natural in this way.
라고 생각을 하고요. 실제로 이렇게 환자분들이
In fact, when the prosthesis is placed in the patient's mouth, they show a great deal of pleasure on their faces. Therefore, the full implant is a treatment that is directly related to the happiness of the patient. I also believe that the face is the most important element that offers such happiness. Although placing implants is important to make natural expressions and faces, how the prosthesis is made is also very important. I also believe it is important to check the prosthesis with the temporary tooth when making the prosthesis. If we were to approach making this temporary tooth by using digital technology, since it is too difficult with the existing analog format, I believe we can make everyone happier. If so, distinguishing whether the prosthesis, including a very small laminate and a very large full mouth implant that is made with analog or digital format I mentioned so far, is not that important. Instead, it is more important that better results are obtained by including digitalization in various aspects of the workflow. Therefore, I believe mix and match is more important. In addition, when such workflow is made gradually, the overall results will be further upgraded. Digital technologies are advancing rapidly every day. Since it is the digital elements that are advancing, we need to apply the elements that have advanced after we have established the workflow to enhance the overall aspects of the treatment processes. To achieve this, I would like to stress that workflow must be established at the dental clinic. What I am stressing today is that workflow is important in digitalization and aesthetic treatment. The workflow is composed of 4 stages, including pre-treatment, treatment, post-treatment, and follow-up stages. Given the time allowed for today's lecture, I explained mostly the pre-treatment stage among the 4 stages. I believe such workflow will be the trend in the future. Accordingly, as mentioned earlier, making a distinction between analog and digitalized procedures is a somewhat outdated way of thinking. What is important is that, rather than distinguishing whether it is an analog or digitalized procedure based on their values or environment, I think they need to use them both by mixing them. In fact, if such a lucid and transparent laminate can be materialized through the digitalized procedure, I will make the final prosthesis through the digitalized procedure. However, since that is not possible, I am going to choose the analog format for the platinum porcelain laminate, despite all the digital equipment I have. Nonetheless, the processes leading to that part of porcelain laminate are carried out through the digitalized format. Moreover, even for the porcelain crown, using platinum porcelain is much more beautiful. There are cases that need these. That's why I am using them extensively in such cases. Cases in which laminate is used partially are like this in the aesthetic treatment. To a certain extent, the results of the efforts we put in are obtained proportionately. What is important is what the higher level would be like. Based on my experiences thus far, enormous efforts are needed after the threshold to achieve even the slightest improvement. I believe the skill is differentiated here by how much effort is put in. I also believe it is important to inform the patient that a lot of effort was put in to make such improvements. While these efforts were only thought of as an advertisement or marketing strategy in the past, I use them to report to the patients in the clinic through digital devices. I am making this comment since these things are very helpful in managing the clinic. I believe these processes are beautiful. Although I was quite concerned about whether digitalization can be grafted onto art in the past, nowadays, digitalization has entered extensively into the realm of art. This is the reason why I chose digital art as the name of my clinic. We decided on the name digital art because my focus is aligned at the balance between digital and art, and on the results we are striving for. At any rate, I am talking about that content by aligning it to that. In summarizing my treatment style, I would like to introduce a case. This patient was also preparing to participate in a beauty contest. She won first place in the Busan region and second place in the nationwide contest last year, and she visited me to try again this year. There were limitations in the treatment due to a relatively short preparation period until the contest. This is the appearance at the time of the initial examination. She visited me due to an unrefined section in the face and had the desire for brighter teeth. We took photos and videos on the first visit, which we stored in our system for analysis. Then, an oral scan was necessary to produce a mock-up. I designed the changes to be made through oral scanning. I then downloaded the file that I designed from the studio before and explained what changes are planned for the patient on the CAD screen. I then printed the 3D printed mock-up model and made a wax temporary with putty, and in just 2 minutes, I visualized how the teeth are going to look like in the mouth. By doing interim checkups on the status through images and videos stored in the studio, I exchanged my thoughts with the patient and checked with the patient on how to make corrections. Then the treatment was performed without deleting the bare minimum of teeth. This is the photograph taken on the day of the treatment. There was a significant change in the face. The patient was greatly satisfied. She was extremely delighted with the fact that treatment was done minimally invasively without damaging the teeth in such a short period of time. This was made by using platinum porcelain laminate. Although the prosthesis was made in an analog format, the processes leading to it were digitalized. Mock-up is very important in such a case. Since correction is difficult once the laminate is attached, there must be sufficient trial and error before attachment, and sufficient communication must be made with the patient for this purpose. Even after the treatment, there is the 3D printer model, so I can compare the results anytime. That is, we report to the patient that such changes have been made. Accordingly, the patient was extremely happy about the changes we managed to make for her. I would like to emphasize that prosthesis made by looking at the face and observing expressions is greatly helpful to the patient than rendering treatment by looking only at the teeth. For this purpose, I would like to point out that digitalization is greatly helpful. In summary, it is possible to check what changes will be made in advance at the time of initial examination through the process of taking a photo of a tooth, taking a photo of a face, and making a mock-up in the middle of the process through the oral scan. In addition, photos were taken again to check which area would need further corrections after the treatment. In fact, when images like this are taken, it is possible to display significant changes. The final prosthesis was made through a slight correction in the mock-up process. The focus is on how much better final prosthesis can be made in comparison to the mock-up by using it as a reference. I also enjoy leaving a record of the treatments I rendered for the patients by taking images and gathering data on all the processes involved. This is not because I am a photographer or interested in photography. Rather, it is because I would like to provide better treatments. As I am continuing to do so, I seem to have markedly improved my ability to make more accurate discernment on what is a more desirable appearance of patients. I can summarize my lecture as follows. If works were conducted using digitalized processes and good prosthesis was produced in an analog format for the patient, such needs to be reported to the patient, and the process of reporting should be in a digital format. These will become the workflow of the clinic, which will become the competitiveness of the clinic in the future. Although my lecture today may have ended up somewhat incoherent, since it is given online, I hope that it has been helpful to you. Thank you for listening